Hi friends, we are going to be talking about a very important area, that's eye genetics, genetic eye diseases, and what are the treatments. A new dawn in eye genetics is transcorneal electrical stimulation. That's a device which slowly sends in some electrical signals to the retina and thereby stimulating it to work better. So this is done widely in Western countries like Europe and US, some of the places, and I wanted to talk to you about it because whatever comes in the line of the RP, macular degeneration, dystrophies, this is one area which I'm constantly exploring and seeing any part of the world, anything is happening, I want to get it to you all. So please stay tuned. So what is transcorneal electrical stimulation? It's a promising new non-invasive therapy being studied for genetic eye disorders like retinitis pigmentosa, macular degenerations, diabetic retinopathy, glaucoma, etc. Let's uncover how it works, its benefits, possible side effects, and how it stacks up with other treatments. What is TES and how it's done? TES uses a corneal contact lens electrode and a skin reference electrode to deliver electrical pulses that stimulate the retina and its neural pathways. The parameters like current example 100 to 200 micro amps, and frequency is 1 to 20 hertz. Duration is about 30 to 60 minutes, depends on patient to patient and their condition. Patients often experience phosphenes, flashes of light, which indicate stimulation of retinal cells. That is the main thing. Once it starts stimulating, they start exploring flashes. So which means that yes, something is happening. So benefits for eye diseases conditions are in RP, it slows the degenerative process, improves visual field, and the ERG measures as well. Statistically proved and scientifically proved. Studies show improvements in visual field loss and dose dependently and transient improvement in acuity of the visual field, visual acuity and visual field as well. The meta-analysis confirms safety and potential to double visual field half-life. So there have been studies done, and in macular degeneration and diabetic retinopathy, early research indicates enhanced ganglion cells survival and function in dry ARMD. In glaucoma and optic neuropathy cases, animal and early human trials show ganglion cell protection and improved field metrics. So how TCS works, the mechanism in an animation video, if I can tell you, TCS promotes neuroprotection by inhibiting apoptosis, reducing BAX and TNF factors. These are some medical jargons, don't have to worry. Boosting neurotropic factors like IGF-1, BDNF, CNTF, FGF2, and enhancing blood flow in the retina. Together, these effects improve cell survival and signal transmission, which is very important, dear friends. So what are the safety and side effects? Does it have any? Let's see. TCS is generally well tolerated in mild dry eye up to 60% of the patients. Conjunctival irritation could be seen in some people or foreign body sensation with contact lens electrodes. No serious intraocular or retinal complication has been noted so far, and definitely I don't think so it will. So contraindications include allergy to electrode materials if there's any, example silver, we should tell them not to go in for it. Active implants like pacemakers, pregnancy, epilepsy, open wounds, and open wounds near the eyes, all as standard caution zones for electrical stimulation. So, what are the alternate and complementary treatments? The side-to-side comparison, there is lots of them. Gene therapies, which target specific mutations, RPE65 gene, but limited to certain RNA, RP subtypes as well. Stem cell therapy, which and other cell therapies, they build new retinal cells. Still largely it is being used, but experimental. Retinal prostheses used in late stage RP to restore basic vision. Traditional treatments like anti-VEGF for wet ARMD, diabetic retinopathy, it lowers, meaning IOP lowering drops for glaucoma. All these are adjuvant therapies along with TES. And TES is seen as a neuroprotective, possibly orthogonal to other treatments. So it can be integrated with other treatments. It is definitely not, the main takeaway is TES is emerging as a safe, non-invasive way to slow vision loss and support retinal health, especially in early RP, AMD and glaucoma cases. While it isn't a cure, it is a powerful adjuvant or bridge therapy. If you are interested, ask more about these clinical conditions and discuss with us on the phone, or come meaning live and see us either online or offline. You can come and meet us, and always consult an eye specialist before proceeding to such devices, right? Because it is available widely, so we should not use without doctor's advice.